Everyone, good evening and welcome back to another live session by IILT. I'm your very own Richard Caroline. So it's been a very long time since I came for another live, and today we are going to look into a very important aspect of OET speaking. So I hope you guys are doing fine, and we do have an exam coming on very soon, and I hope your preparations are going well. So today, while I was thinking about what topic I need to take for you guys, I thought about let's discuss about the areas or what are the things that contribute, or what are the things that might affect your performance. Okay, kind of like what is the reason, or what are the reasons why you might lose your score. So we are going to discuss 5 problems or 5 things that you need to reconsider while you're preparing for your examination. Okay, so these things will definitely help you to increase your score, as well as you will know the areas where you will be losing your score and what are the things that you have to do and what are the things that you have to consider in order to improve your score. Okay, so I hope you guys are fine. So Manju, hi. So if you guys have any questions, or if you guys would like to discuss about any particular queries that you have about the speaking, feel free to ask that. I would be happy to explain the points to you. Okay, so I told you that I have prepared 5 different explanations or 5 different reasons why you lose the score, and I'll tell you the reasons why that is kind of like an area where you're losing the score. Okay, I'll explain in detail about how that will affect your marks. So if you have any queries about any error. Am I audible right now? If yes, please let me know. All right, there was a small technical error. Sorry about that. Yes, so I was explaining few things. I'll just go over the details that I've told you right now. So I was saying today we are going to discuss about the reasons why you lose your score for the OET speaking, and I have framed 5 different things that will affect your performance. Okay, some things that you really need to reconsider while you're preparing for an examination. So in between, if you have any questions, please raise it. I'll look into it and I'll explain that to you. And yes, so before that, Anthony is happy to see you back again. Thank you, sir. And Tina, hi. All right. So before we get into this session, the thing that I need to tell you is that speaking is an area that requires a lot of practice. It will not improve overnight. You really need to put in an extra effort to improve this particular area. So we are going to discuss few details and few explanations as in why you are not getting the desired score, or as in why it is affecting your performance. Okay, and I'm pretty sure after this you will be able to get a clear-cut idea, and okay, after this you will be able to understand, yes, I have to avoid these things and then improve. And in case if I'm not audible, please let me know. Okay, I can check that. All right, so let's look into the first reason why you are losing the score, or why you are not getting the B grade or the desired mark. Okay, the first thing I have to explain is that unawareness of criteria. Okay, people do not, or the candidates, when they prepare for the examination, they just directly get into the practice session by doing the role plays or speaking with their partner, but they do not spend time to understand what exactly is the criteria that you need to follow. You know that for the speaking test, you have two criteria, right? Linguistic criteria, which assesses your language skill. On the other hand, we have the clinical communicative criteria as well. So you need to know what are the parameters that comes under these criteria. You need to know how you will be marked. Based on your performance, what will be your band score? You need to have a clear idea about that. If you're clueless about the sole purpose of the role play, then you won't be able to get the desired score. And let me ask you, what is the sole purpose of a role play? Or what is the purpose of it completely? Why are you doing the role play? The main reason why you're doing it is to show or to demonstrate how you will be handling a patient in the future. So this is a preview of your future, okay? You're showing that in the future, if you get a patient, this is how I will be dealing with that patient. Okay, so you're demonstrating yourself, right? So you have to enact it. So that is the main purpose of it. People always have this wrong idea or wrong assumption that role play means 5 minutes, time management, task completion. No, it is not. Task completion is not the main idea of the OET speaking, okay? Tasks are important. I'm not saying it is not important. Yes, you have to give importance to it, but that does not mean it is the entire thing, okay? It is not the whole thing. Tasks are just medium that has been provided for you so that you can speak based on that for the 5 minutes, okay? So you have to speak according to what is being provided to you, but that doesn't mean you have to rush in order to complete all the tasks. Even if you don't finish all your tasks, that is fine, okay? You will get the score if you have met the criteria. So you need to have a clear idea about the criteria. So if I give you an understanding of the criteria, as I mentioned, I told you there are linguistic criteria and communicative criteria. And under the linguistic criteria, you have 4 parameters, okay, such as intelligibility, fluency, appropriateness of language, and resources of grammar and expression, okay. And each of these carries 6 marks. And you need to know how these marks are distributed. Based on your performance, what would be your band score, okay? If you make some mistakes, will you lose your score, okay? If my conversation got cut, or if I go blank, or if I hesitate, if I self-correct myself, will I lose my score? If I have a lot of mispronunciation, what will be my score? You need to have a clear-cut idea about it, okay? And I am doing a video series which consists of 9 episodes, through which I'll be explaining about the criteria and how the marks are given. So if you have not watched it yet, you can watch it on our YouTube channel. So far, I believe I have done three episodes of it. So I'm covering each criteria one day by day, and so that you guys can have a look through it and try to understand, okay, based on these performance, this would be my expected mark, so that you can evaluate yourself, and based on that you can try to improvise, okay? So that is going to help you really well. So intelligibility, if I speak about it, I'm just going to give you a brief idea about it. It is nothing but it is the clarity of your speech. Okay, if you need to be a clear communicator, you need to have a good pronunciation. Whoever is listening to you should be able to understand you at a single go. So they will check whether your pronunciation is clear, okay? Along with that, they will also check your prosodic features. Prosodic features are nothing but, it means the stress, the word stress, the sentence stress that you're giving or putting in while you're talking. Then about the intonation, the rhythm, the tone of your speak, all these things, okay? And if it is clear, and the examiner or the assessor don't feel any strain to understand what you are saying, then you will get a 6 out of 6 for your intelligibility mark. Okay, so you need to know that, you need to understand that, okay, I'll get a 6 out of 6 if I do these many things, okay? And your score will come down to 5 if you have few pronunciation mistakes or prosodic feature mistakes, but your conversation was understandable, okay? There was only a minimal strain for the examiner to understand what you were saying. If that's the case, you will not get a 6, but you will get a 5, Okay, so this is how your scorings go. You need to know, okay, how my scorings are done or based on my performance. Okay, say for example, today you did a role play and you got feedback from your trainer or from your speaking partner. So based on that, you will have an idea, okay, this is how I spoke. These are the mistakes I made. Okay, I got stuck, but I managed it. My conversation went well, although there were little bit mistakes here and there, but I kind of like managed it. So then based on this, you can give yourself a score. Always score your performance because you need to know where you are standing. Only then you will be able to improvise. Okay, so that is intelligibility part. All right, so the second one which comes under linguistic is the fluency part, and people always have this misconception about fluency that if you speak really fast, that is called fluency. That is not fluency. Fluency is the ability of you to speak at a normal rate of speech which is clear for the examiner or the interlocutor, whoever is taking the exam for you. Okay, so if you need to be a fluent speaker, you need mental as well as physical practice. When I say mental and physical practice, I'm mentioning about the thought process as well as your flexibility of your mouth to produce or verbally produce the words. Okay, so sometimes we always say that, right? And I do have all the ideas in my head, but I'm not able to put it into words. Why is it like that? It is because you don't have the physical practice of speaking. So you need to practice that. So repeatedly you have to practice. So again, when it comes to fluency, if you are, entire conversation from the beginning till the end, if you are maintaining a normal rate of speech and you are not hesitating or you are not not breaking the conversation, so if it is going very smoothly, then you'll get a 6. But you were kind of like occasionally here and there you got a break, like you were hesitant as well as you made few mistakes, so you self-corrected yourself also occasionally, maybe 1 or 2 times or maximum 3 times, your score will be 5. Okay, then if it is more than that, your score will be 4. So that is how it goes up and down. So you need to have an idea about that. So that is fluency. The third one is appropriateness of language. Okay, it is purely your way of talking, like the like the register, the tone, the voice modulation that you put in. Also, they will check the lexis of context. Lexis of context means the choice of words that you use to convey the message depending on the situation, the context. Okay, so for example, you cannot talk the same way to a concerned mother, okay, as well as a businessman. Okay, both the requirements would be different. So you need to try to understand what exactly this patient requires and what exactly this patient is looking for, and based on that you have to provide your explanation and you have to maintain your voice modulation, your intonation, your tone and everything. Okay, so if you have that ability, then you don't have to worry. Okay, and if you don't have it also, just keep practicing. Stand in front of a mirror, record yourself and listen to yourself, evaluate yourself, and just go on and on like that. If you have the repeated practice, don't worry, it is going to be easy. Okay, it's not like a Herculean task. You can definitely do it. Also, under the appropriateness of language, they will also see whether you are able to explain the medical terms in common language. Okay, because our patients are like laymen, so you need to explain everything in the normal language which is understandable for common people. So they will check that too. So if you are meeting these 2 things, you will get a 6 out of 6. Okay, but if your voice modulation is not that good, but you kind of like conveyed some message and you were a little bit empathetic here and there, and you were kind of like occasionally you were having a little bit of lapses, but those lapses as in those breaks, the breaks or the blank that might come while you're talking, that is not intrusive. Intrusive as in that is not breaking or disrupting the flow of your conversation, then your score will be 5. Now, if you're making these lapses, if you kind of like get these lapses and it is affecting the flow of conversation, your score will be 4. So this is how it changes. Okay, and the last parameter under linguistic criteria is resources of grammar and expression. So I don't think I have to explain that again. By the term grammar, you will clearly understand that, right? So it doesn't mean if you make few grammatical mistakes, you'll lose all the score. Okay, no, it's not like that. And most of us have that fear of talking because we fear the grammatical mistakes. quite understandable. Okay, even when I take classes, my students also kind of like, some of them kind of like experience that fear, or they are very nervous to talk, and they have this consciousness that, you know, I'll make mistakes, so that they kind of like speak with a hold. They're not very free, or they're not very smooth while they're talking. So what I tell them is just let it go, make the mistakes, learn from the mistakes. Okay, what is the, you know, what is the extent, or what can happen? Like if you talk and if you make a mistake, that's it, you made a mistake. So the next time you can rectify that mistake. So you do not have to worry about making mistakes. You can learn from the mistakes. Okay, so grammar is kind of like a main problem for all of us, but don't worry. You just need to know that you just need to communicate, and even if you make few mistakes here and there, that is all right. Okay, see, if you kind of like made a couple of mistakes, your score will range between 4 or 5. Okay, even if you don't get a 6 out of 6 for the grammar, you don't have to worry. If you know, if you kind of like used good vocabulary as in if you're using different words to describe the same word. Say for example, important. Okay, in one line you said important, so the next line, you know, even if you are again going to explain about the significance of something or importance of something, you can come up with the word vital, crucial, imperative, significant, relevant. So there are a lot of terms that you can use, right? So if you're kind of like putting in a good vocabulary like that, and a little bit of grammatical mistakes also, your score can range between 4 and 5. And one main thing I can tell you here is that if you struggle with grammatical mistakes, and if you often make mistakes, make a list of the common mistakes that you make and learn from that. Write it down, okay? Write the mistake and write the correct form of it, and go through it whenever you get time, so that you are registering it in your mind, and next time when you talk, you can, you know, kind of like rectify it, try to rectify it. And I'm pretty sure if you recorrect it one time, it is going to be easier the next time. Okay, because if you are externally putting that effort to correct your mistake, even one time, that is going to help you. Okay, that's because the second time you will remember, okay, last time I corrected it, so this is it, how this is how I have to say that, so that it is going to be easier for you. So make a list of the common mistakes that you make. Okay, so these are the different parameters that come under that the linguistic criteria, and each of these carries 6 marks. Okay, so that is a total of 24, because you have 4 parameters with 6 marks each, so that is a total of 24. So you need to try to get a minimum of 18 to 20 out of this 24. Okay, so that is the linguistic one. And then the clinical communication criteria, it is very crucial. Okay, clinical communication criteria has 5 parameters. And the first one is relationship building. As the name suggests, you need to meet in a good relation with the patient. You should not be judgmental. You should be very friendly, very polite, and things like that. Okay, and you have to provide empathy. You have to be very respectful to the patient. You have to listen very careful to the patient. So if you are doing all these things, you will get 3 marks. Okay, that is how it is. The second parameter is understanding and incorporating patient's perspective, which means whether they will see whether you are trying to understand what the patient requires, and based on that, whether you are giving a logical explanation to the patient in the role play. Okay, they will try to see whether you try to collect the expectations, you try to ask about the concerns of the patient, what the patient is expecting from you, what is the requirement of the patient, they will see to it. Also, they will check whether you are able to understand, or whether you are able to focus on the patient cues. Sometimes during the role play, the patient will give you some cues like, you know, I have a very stressful job, or I don't have enough time to exercise, or things like that. So these are cues the patient is telling you. The patient is telling you, I'm stressed. The patient is telling you, I'm a very busy person. So they will see whether you are listening to this, and then you are giving an explanation which is logically suitable for this particular explanation. Okay, so that is another thing they'll check. Then they'll also check whether you are providing explanations which are flexible and feasible for the patient. So if you're meeting all these things, again you'll get another 3 marks. Okay, then the third parameter that comes under clinical communication is providing structure. You just need to keep in mind your speaking or your communication has to have a logical sequential flow. it should be like a story. You need to develop a storyline, okay? Do not have to worry about how to organize it. Just start from the beginning until the end. Just go like that, okay? That's the only thing you have to do. You do not have to worry about framing or structuring or organizing and spending extra time for that. Nothing like that, okay? You start from task number 1, finish it, start the task number 2, just go on and on like that. That's enough, okay? Also, here one major point that you have to keep in mind is that signposting. Whenever there is a shift in the topic that you're discussing, you have to signpost. And signpost is nothing but you're indicating the patient that you're changing the topic, okay? Say for example, after you introduce yourself and if you want to gather some information from the patient, we normally say, before proceeding further, I would like to ask you some questions, right? That is a signposting statement. When you say like that, you're indicating to the patient, okay, now I'm going to ask you some questions, so the patient will be prepared. Okay, yes, I can expect some questions from the nurse now, okay? That is one thing. So, or in the next task, if you're going to explain about the treatment options or the procedure, again you have to signpost. All right, Mr. David, now we will discuss about the treatment options. So that line is also indicating, okay, yes, now we are shifting the topic, okay? So the patient will be like, okay, now I'll get the treatment options. See, it is very important. And signposting is something that candidates miss out. You have to always signpost whenever there is a shift in the topic that you're talking. Okay, that is very, very important. So these are the things that you have to consider while you're providing while you're doing the role play, providing structure. That is the next parameter. Okay, the fourth one is information gathering. Information gathering is when you ask some questions to the patient and you collect information from the patient, okay? So the reason why this is important is because we need to gather all the relevant details from the patient so that we will get to know what exactly is wrong with the patient and what the patient requires from you, okay? And you need to check the understanding of the patient. Even when you're explaining something to the patient, you need to ask a question, are you following me? Do you understand? Is it clear for you? Something like that, so that you will get an understanding whether the patient is following you or not, and that is important. It comes under this particular criterion, okay? You have to keep that in mind. Then when you're gathering information from the patient and when the patient said something and it was unclear for you, you need to clarify it. Do not go with unclear statements, okay? Do not assume things. If you didn't understand one thing, that's okay, you can clarify it. You can say, Mr. David, I couldn't quite catch the last part. Could you please repeat it again? Okay, just clarify it. Do not go with wrong assumptions. That will only bring down your score. Then whenever you gather information from the patient, you have to provide a summary, okay? Summary to check whether you have received the correct information from the patient, okay? That is also important. So these are the few things that come under the information gathering criterion, okay? And the last one under the clinical communication criteria is information giving or information providing, okay? Which means that you have to you're explaining things, maybe like the diagnosis explanation or the treatment, the procedure, things like that. You're giving explanation, you're educating the patient, you're imparting knowledge to the patient. So the things that the examiner or the assessor look into this particular criterion are, they will see whether you have checked with the patient what the patient knows about the condition, and they will see whether you are periodically pausing while you are giving the explanation, because the explanation has to be clear. Then they will see whether you have encouraged the patient to contribute their feelings, okay? Say for example, when you give a suggestion and you're checking with the patient, are you okay with it, or will that be all right with you, so that you are actually encouraging the patient to open up, okay? If the patient is unhappy with it, the patient can say that, right? You're not forcing the patient to do something. Instead, you're actually suggesting something and you're seeing that whether the patient is okay with it. And they will also check whether you have checked the patient's understanding, like when you give an explanation, you are asking the patient, are you following me? Do you understand? So that comes under this too. And lastly, you have to ask a question like, do you have any other concerns? So that you're trying to figure out whether the patient has any further questions or any concerns that is bothering the patient. Okay, so all these things come under information giving. Only when you meet all these things, you will get 3 marks. So these are the parameters that you need to focus on, and whenever you are practicing or whenever you are preparing for your speaking test, you need to consider all these things. Based on these things, you have to perform. You have to, you need to check whether your speaking is meeting all this, or whenever you talk, you have to see whether, okay, am I making any mistakes? Am I self-correcting myself? How is my hesitation? Am I completely hesitant or occasionally hesitant? So you need to have an understanding of that. If you're unaware about your own performance and its relation with the assessment criteria, then you will not be able to get that mark. Okay, so first learn your assessment criteria. Learn as in you need to know about it. You need to be familiar about what are the things that you need to meet. Okay, what is expected from you, what they're going to check, what are the potential and caliber that you have to showcase in order to get the proper mark. Okay, so based on the criteria, practice it. Do not directly start with your speaking sessions or your speaking discussions. First you need to understand what exactly you have to perform, and then based on that you can perform, or you can start your preparation. Okay, so that is the first thing, or that is the first reason why people lose the score, unawareness of the assessment criteria. Okay, yes. Okay, so there is a question which is being asked here. In role play, we will ask what you brings today or what you brought today, which is correct. Actually, there is both these statements are grammatically incorrect the way you have typed it. So you can ask in two different ways. Okay, you can say what brings you here today. Second one, you can ask what brought you here today. Okay, those are the two different ways of asking it. All right. So the second reason why people lose their score or not getting the desired band is lack of practice. Okay, let me ask you a question. How many hours do you speak in English? Or how many hours do you spend to do your speaking practice? 1 hour? 30 minutes? Yeah? I think if you join for an online class, or if you go for regular class also, or if you're doing it with your friends or family, anyone also, you won't be spending more than 30 minutes. Okay, because you would be maybe doing 1 role play or 2 role plays, and your practice in a day would be just 30 minutes, barely, like hardly 30 minutes. Even in that 30 minutes, you're only speaking in English, or you're only engaging in the conversation for 5 minutes each, or so a total of 10 minutes, because if you're doing 2 role plays, so that will be 10 minutes. And do you think you can improve in your speaking just by doing this, just by speaking for 10 minutes a day? No, you will not. Okay, if you want to improve your reading, what do? You read, right? Even when you're practicing for your reading module, the thing that you do is you read. Okay, listening, again, you listen. If you were not able to understand that, you listen it again, right? Writing, same way, you write, and you write. Same applies to speaking too. Just by doing this OET speaking session for 5 minutes or 10 minutes or even 50 minutes a day, it's not going to improve. Okay, you need to put in an extra effort. Go an extra mile for that. Okay, the reason why I'm telling you that is because it takes a lot of practice. Without that, you cannot just by heart a lot of things and then just go there and speak, because sometimes during the examination or even when you're doing the practice sessions, you can expect the unexpected answers from the examiner or your speaking partner, right? Because in your mind, when you see the case note, you would be expecting, okay, this would be the way this person is going to respond to me. So you will be preparing like that. What if an unexpected response came from the other end? What will you do? You will panic, right? So if you by heart, this is what is going to happen. You will panic and you won't be able to convey the messages. All right, so in order to avoid that, you need to practice a lot. Okay, not just 30 minutes, you need to make sure that you are engaging in conversations every day, and try to read something. Okay, read aloud. Take an article and read it aloud. Okay, make it a habit of doing it. Okay, so that you are kind of like having a physical exercise also, because when you're reading, you're giving a physical practice to verbally pronounce the word, so that it will be also flexible for you the moment you talk. So always practice. Break your comfort zone. Go out and talk. If someone is making fun of you, don't mind. Okay, why do you have to bother about it? You do not have to bother about it, because it's your requirement that you need to pass the exam. It's your requirement that you need this language once you go abroad and start working. Okay, it is a kind of like a very huge investment. Okay, so practice it. Without practice, just by learning a lot of things, just by learning the structure, a lot of empathy statements and things like that, it's not going to help you. It will only be improved when you improvise yourself. So practice. Okay, so lack of practice is another reason why people lose a lot of score. So just keep that in mind and practice it. Okay, not just 5 minutes or 10 minutes, contribute more, invest more time. Okay, your hard work will definitely pay off. Just keep in mind you do that. Okay, the third reason why people lose their mark is because of improper learning and correction methods. Yes, how do you learn it, or what is your preparation strategy? Do you have a preparation strategy, or you just wake up a day, you do some reading, you do some listening, you do some writing, and when it comes to speaking, you take a cue card and you just sit with your partner and you talk? Is that what you're doing? That's not the right way to do it. When you start your preparation for the speaking module, the first thing you have to do is you have to learn the structure of the role play. The introduction. Once you introduce yourself, you have to check with the patient what the patient requires or how the patient is feeling, depending on the scenario, like non-case or unknown case. Then based on their response, you need to provide an assurance. Then you have to signpost, you need to gather information. Based on that, you have to provide information, and then you have to provide an advice. Then you have to reassure about this advice, and then you have to conclude. See, this is the basic structure of your OET speaking. You need to know this, because all the cue cards or all the speaking conversations are designed according to this. Okay, so if you know this, there will be proper structure, proper sequential flow for your conversation, which will definitely improve your score. Okay, so the first thing you need to learn is your structure. The second thing is you need to pre-plan few sentences or few explanations beforehand. Okay, say for example, you can learn your introductions based on different settings, based on different scenarios. You can learn your introductions, you can learn your initial assurance, you can learn your signposting statements, you can learn your action words, different action words like explain, confirm, provide, politely, tell the patient, something like that. So there will be different action words, right? So you can pre-plan that. You can pre-plan the short questions, okay, like once I explain the diagnosis, what should be the short question? Is that clear for you? Do you understand? Are you following me? Or once I give a suggestion, what should be my short question? So these things can be pre-planned. Okay, so I'm saying 60% of your cue card can be pre-planned, because all these cue cards or all your speaking sessions will have these things. An introduction would be there, an initial assurance would be there, signposting would be there, action words would be there, okay, short questions would be there, conclusion would be there. So you kind of can pre-plan it. Okay, so certain sentences can be pre-planned. So before you start with your speaking sessions, make a list of the common statements that you repeatedly use in your speaking and learn it. Okay, make a habit of repeatedly saying that every day, so that you are very familiar with it and you will not get stuck while you are doing the speaking sessions. Okay, because you know a set of statements or sentences that you can use in the speaking session. All right, so plan it like that. Not just the planning thing, okay, not just I'm not just talking about the proper strategy of the learning. You need a proper correction method too. The person that you're talking with or the person that you are doing the speaking with should be able to guide you in a proper way. Okay, whoever it might be. Maybe some of you might be training with your friends who have already written the exam. Some of you might be doing it online, some of you might be doing it, you know, on a regular basis, in a regular batch or something like that. Wherever you do, you need to select the person very wisely. Okay, do not simply get explanations or feedback from anyone randomly, because you need to know whether these corrections are going to help you. For that, you need a certified trainer, so you need to make sure that the corrections that you get is valid. Okay, it should be updated, it should be appropriate, it should develop you. Okay, so the partner that you are talking with, or the trainer that is training you, should be able to understand your weakness and your strong areas, so that that person can help you to improve on that. Okay, can give you guidance about how to improve on that. So that is very important. You need a proper correction method too. Okay, it's not just about doing it. Anyone can just do n number of role plays. Okay, anybody can do that, but do not just do speaking sessions back to back without getting proper corrections. Okay, learn from your corrections. You need to understand what exactly was lacking in your speaking, so the next time you need to rectify it too. So that is another strategy. Okay, make a note of the mistakes that you made during your speaking test, okay, or during your speaking session. Make a list of it. Okay, so for example, Monday you did a role play, so you made few mistakes. Okay, so make a list of the mistakes. The next day when you do it, or the next time when you do it, try not to repeat the same mistakes that you made on the previous day, because you already know these were the mistakes that I made. So know your mistakes and try not to repeat it. So if you're trying not to repeat the same things the next day, that means that you have succeeded. Okay, you are just above one line. Okay, you're just one line above that. So just do like that. So the next day, Tuesday, you might make some new mistakes or some repeated mistakes also sometimes. So make a note of that too. Okay, the next day, the day after that, try to avoid these mistakes. So it just goes on and on like that. So by the end of a week, you will have a lot of mistakes that you made. So you can tell yourself, okay, I made all these mistakes, so I am going to sit down this weekend and I'm going to learn my mistakes, and I'm going to make sure that I'm not going to make it the next time. Okay, so that is how you improvise yourself. So you need to have a proper learning technique as well as a proper correction too. Okay, so that is something people miss out. Without this proper learning technique or a proper correction, you won't be able to get a proper score. Okay, so keep that in your mind. Okay, that is the main reason why people lose the score, because they're not getting the proper correction, they're not knowing their mistakes, they're not knowing which area they're good at, they're not getting a guidance about how to improve their weak area. Okay, you need that, only then you will be able to improve. Okay, so at IILT we are providing a syllabus oriented classes. Okay, and when it comes to the speaking, not just speaking, reading, listening or writing also, we actually provide exclusive materials which are prepared by the OET certified, badged certified trainers, so that these materials will definitely help you to improve in a good way. And the classes that, or the feedback that we provide also, we make sure that the students understand which area they're good at and which area they need more practice. Okay, so based on that, they are evaluating their performance and trying to improve. Okay, so if you guys are interested for that, you can always contact us and we'll be happy to help you with it. All right, so moving on to the next one. The fourth reason why you lose score is not understanding the context properly. Sometimes candidates read the case note or the cue card, but they won't be able to understand what exactly is given there. Only when you understand the context or the situation where the conversation is taking place, okay, the requirement of the patient, what exactly is the problem of the patient, what are the suggestions that you have to provide for the patient, how you can solve this problem. Only if you have a clear idea about all these things, you can provide a good, or you can present a good speaking or a good speaking session. Okay, so that is very, very important. You need to know what is expected from you. Okay, what you are supposed to convey, what is the requirement of the patient. By reading the background information from the cue card, you need to understand whether it is a known case or an unknown case. Based on that, you have to frame your introduction. Okay, sometimes people get really confused about their introduction, because they will be really confused about, they will be clueless about, okay, whether this is a known case or an unknown case. Why does it happen? It happens because you do not know the different contexts or different situations that you can get for the examination, and you didn't pre-plan the different introductions that you have to speak. Okay, so you need to read and understand and try to decode and comprehend the exact meaning which is given there. Sometimes in the cue card, the setting will be given as an emergency department. Okay, just by seeing that, people will come to the conclusion, okay, it's an unknown case because it's an emergency department. It might not be. Okay, in the background information, it might be said that, after examination, it was found that, or you just examined the patient. Okay, so if the examination is done and if it is mentioned that the examination is over and some findings have been found, it cannot be an unknown case even if the setting is an emergency department. So you need to try to understand the context. If you don't understand the context, you will just directly treat this entire case as an unknown case, and you will start by introducing yourself and asking for the name of the patient. You're asking the name of the patient for whom the examination was already done. You do not have to do that. Okay, so you need to understand the context. Okay, you need to read every line or every word very clearly and decode or comprehend the exact meaning. Do not be clueless about it. Okay, so you need to practice it. Alright, you need to read and try to analyze, okay, this is what is happening. Okay, you need to see whether the examination was already done, whether this is a new case, whether it was a follow-up case, it was a referral. Sometimes I have seen people misunderstanding the entire context, okay, because it will be clearly mentioned on the cue card that the GP referred the patient to you for to give explanation about some lifestyle changes. Okay, so it should be treated as a known case because it is a referral, and when it is a referral, the GP will not randomly send some guy or some person. Okay, the GP will be handing over a report or will be informing you that so and so person will be coming, right? So you cannot treat it as an unknown case. You have to treat it like a known case. But then you have to confirm whether you're talking to the right person, because the GP was a person who had an encounter with this person. It's not you. So you have to introduce yourself there, and then you have to confirm, are you this person? Okay. For that, you need the name of the person. All right. So you need to ask the interlocutor during the 3 minutes preparation time, how may I address you in the role play? So these are the certain things that you need to know. You need to understand the context. Okay. So in order to understand this context, you need pre-planning, as I told you earlier. Okay, make a list of the common scenarios or the common settings that you might get or common context that you can get, and prepare different introductions. Okay, and these introductions will definitely help you. Got it? So you have to follow that. So that is the next one. Okay, that is a fourth reason why people lose the score, because they do not understand the context. They do not understand what is the requirement of the patient. So for example, if you are talking to a patient who is really angry for delayed treatment, what is the requirement of that person? The requirement of that person is a promise that this will, or an assurance that this will not happen again. Instead of providing that assurance, if you're trying to defend yourself, that is not going to help you. If you're trying to tell the patient repeatedly, please understand I was busy with another patient, that is not going to help you. Okay, you can explain why there was a delay. Okay, that is understandable. You can tell the patient, okay, this is the reason why I was delayed. But then you should not stop there. You should not defend yourself by saying that, please understand, this is why I was late. No. You can say, Mr. David, I'm sorry for your rough experience. The reason why I was late, or the treatment was delayed, is because the emergency department was really busy. I know that it's not going to justify the rough experience you have had. Okay, but I assure you this will not happen again. That is something different. Okay, so if you're just telling the patient, I was busy, I was doing this with another patient, that is the reason why I couldn't come, please understand, the patient is not going to understand. The patient will be like, okay, so I'm not important, I'm also paying my bills, I'm a tax paying citizen. What will you do then? So always make sure that you try to understand what exactly is the requirement of a particular patient or a bystander. Based on that, you have to come up with your logical explanation. Okay, so if you're talking to the concerned mother, a concerned mother requires reassurance that the child will be okay. So you need to provide that. So you need to understand the context like that. Okay, so always keep in your mind, do not simply just do any role plays, or do not simply just start doing or explaining the tasks. You need to know the inner meaning of it. Okay, that is very significant. Okay, so that is the fourth one. Now, so yes, so the last one, Okay, I told you there are 5 reasons that we are going to discuss. So far we discussed 4 reasons. So just to go over the 4 reasons, the first one was unawareness of criteria. That is the main reason why people lose the score. The second reason is because of lack of practice. The third one is improper learning and correction methods, because you're not following a proper strategy. And the fourth one was not understanding the context properly. Okay, moving on to the last one. The last one, I kept it last because that is the main feature I want to discuss with you guys. Okay, the major reason why you are not able to get the desired score, that is a B grade 350, is because your approach to the role play is not correct. Okay, if you are having a task oriented approach, I'm afraid you will not get the score. Okay, or you will not get the desired score. The reason why you are not getting it is because task completion is not our main aim. Our main is communication. You're showing how you're going to communicate, how you're going to initiate a conversation with the patient, how you're going to understand the problems of the patient, how you're going to encourage the patient to speak up their concerns, speak up about their concerns, their expectations, their problems. Okay, they're going to see how you provide suitable or feasible solutions to the patient by understanding what exactly is the requirement. They're going to see whether you are checking the patient's understanding, whether you are being polite with the patient. So these are the things that they're going to assess. They're not going to assess your task completion ability. I've seen many times candidates just directly jumping into the task when the patient raises a concern. Okay, when the patient raises a concern, they are expecting an answer. Yes, I understand that, but they are also expecting an acknowledgement. Okay, so when the patient asks you a question like, how long will it take for me to recover? Yes, the patient needs to know the time frame, but still the conversation will be better if you build a rapport with the patient by telling the patient, Mr. David, I do understand you're really concerned about your recovery period. Don't worry, let me make it clear for you, let me explain everything in detail for you. Okay, if you say a line of acknowledgement like that, that is different. Okay, that is more patient-centric approach. Task-centric approach or task-oriented approach is when you're just directly giving out the answers. Another area I need to point out is when you ask questions, okay, information gathering. You're asking the patient, do you have pain? The patient is saying, yes, I have terrible pain. The next question, very directly, even without responding anything to the patient's response, you are asking the next question, so where is your pain? Okay, then the next question, so if I gave a pain scale of 0 to 10, where 0 is no pain and 10 is the worst pain, how much would you rate it? So if you just go on and on like this without responding to the answers of the patient, you're not building a relation there. Yes, you're doing the tasks, but that is not what we're looking for. We are looking for your capacity to handle the patient, your ability to move forward with a smooth conversation. Okay, so you need to interact there, you need to show your potential and caliber to interact, initiate a conversation, move forward with it and finish the conversation in a good way. That is what we are looking for. Okay, not task oriented approach. If you're just covering all the line which is given in your cue card, all the details which is given in the bracket, everything is done. Okay, everything, you covered everything, but still you're getting 330, 340. Why? Because it was not conversational. So it is high time that you understand that task-oriented approach is not going to help you to get a good score. If you need a good score, what you need is patient-centric approach. And how to do that? Be empathetic. Okay, active listening, non-judgmental approach, feasible solutions. Okay, be very responsive, be pleasant, be active. Okay, do not just go scripted. Okay, because you will learn a lot of statements and you just by heart it, and while at the time of speaking you just give it out. No, learn it. Okay, it's good to by heart, or it is good that you know some statements by heart. So when it is a time for you to speak it, you need to make sure that you are talking in a way that you are communicating it. You are having a conversation, okay? So do not simply come and say, good morning, my name is Richa, one of the registered nurses working in this emergency department. Bang, I said the statement because I by-hearted it, right? No, That is not a conversation. That is you just saying a statement without any emotion, without any interaction and things like that. If you need a better score, what you have to do is you need to talk as if you're having or as if you're engaging in a conversation, because you are enacting this entire setting, right? You're showing or you're demonstrating, this is how I will take care of a real patient. So you have to do that. Okay, do not simply be task oriented. You can say like, good morning, my name is Richa, one of the registered nurses working in this emergency department. How can I help you? That is different. Okay, so do not ever sound scripted while you're doing the role plays. You need to make sure that you're conversative, you are understanding the patient, you're being very responsive. Like when you ask questions, as I told you earlier, if you ask a question like, do you have pain? And when the patient is telling you, yes, I have severe pain, say something like, oh, I'm sorry to hear that. Or you can say, oh, that must be difficult. So let me ask you, aren't you taking the pain medication? You see how the communication is going like that? If you just ask questions one by one, it will be just like question, answer kind of a thing. No, that's not what we expect from you, okay? If you ask a question, the conversation should go from the answer of the patient. When the patient tells you, yes, I have severe pain, you should respond by saying, oh, that must be really difficult. So let me just ask you, are you not taking the pain medication that we have provided you? Patient said, yeah, I'm taking it, but it is not very effective. You can say, I'll make a note of it. So, Mr. David, if I provide you a scale of 0 to 10, where 0 is no pain and 10 is the worst pain, how much would you rate? So, patient is saying, oh, I would rate a 9. You can say, oh, that must be severe. I understand. I'll inform the doctor about it and let me see what we can do about your pain medication. See, you are communicating, you are building your next line of conversation based on the response that you got from the patient, and that is patient-centric approach. Okay, you are an active listener there. You are understanding the perspective of the patient. You are incorporating that detail into your logical explanation, so then you'll get a better score. Okay, that is what you have to do. But if you just complete the task without being without being interactive like this, or without making a conversational performance, then you will not get that score. Okay, so these are the reasons why you tend to not get a good score. Okay, so these are the main 5 reasons why. There are other reasons too, but these are the main 5 reasons. Unawareness of the criteria. I'm telling you this again and again because the moment you decide to prepare for your examination, be it any module, I'm not just talking about speaking, be it any module, you need to understand the criteria. You need to know what exactly you are expected to do, what exactly you need to prove, what are the parameters that you will be judged with. So you need to have a clear-cut idea about all these things. Only then you will be able to perform well. Okay, when you know, okay, this is what I'm being assessed on, you will know. You know, if you know the portion, if you learn the portion, you can attend the exam very well, right? That's how we did in school with the proper syllabus. We know, okay, this question is very important, so this question might come. So you learn that question, and if it comes, then it's a very easy way to answer, right? Same way. Same thing happens here too. So you need to know what your criteria are and what are the things that you are expected to do. So based on that, you have to provide an explanation. The second thing that you have to avoid is your non-practice nature. You have to avoid that and start practicing. Go out and practice. Okay, tell yourself, okay, from today onwards, I will spend at least 30 minutes or 1 hour for my speaking module 2. Okay, because when you do reading, you spend 1 hour. Okay, when you do listening, you spend 45 to 1 hour again. When you do writing again, you spend 1 hour. Okay, or 45 to 1 hour. Again, speaking 5 minutes. No, that's not going to help you. Okay, you need to spend a little more than that. Okay, so that is the next thing. And the third thing, very important, improper learning methods and correction methods. Strategize your learning. Okay, you should know, okay, if I make this mistake, I'm going to make a list of the common mistakes that I make, so the next time I'm not going to make the same mistake. Okay, I'm going to make a list of the common statements that I use in the role play, so I'm going to learn it every day so that I will not get stuck while I'm talking that, while I'm delivering that in the speaking session. Okay, plan it. I'm going to make a list of the common introductions so that I'll be very thorough with it. I'm going to make a list of the common statements or common short questions that I use in the role play so that I can be very fluent when I'm talking. So pre-plan it. Okay, and get good correction. As I told you again, you need to get good corrections too. The next one, not understanding the context properly. Read your cue card very carefully. Okay, try to understand or comprehend what exactly is happening, whether it is a new case, whether the examination was done, whether it is a follow-up, a referral, or anything. Try to understand the context, understand that, and then start speaking. Do not just jump the gun. Okay, do that. And lastly, task-oriented approach has to be avoided. You need to make it more patient-centric. And I'm very sure if you are following this and reconsidering these points, you can definitely get your B grade. Okay, you need to do that. So start working on it like that. Okay, so that is what I had to discuss with you guys today, and I hope it was helpful for you guys. If yes, let us know, and based on that, we can come up with new live sessions or few topics or the content videos or anything like that. So one more thing I need to remind you, which I discussed earlier. So based on about the criteria, so we are making a video series. Already 3 episodes have been aired. So if you have not watched it yet, you can go and watch it and learn the criteria. Okay. So 3 episodes have been already aired, and the rest will be following soon. So keep watching, stay tuned, and I'll see you guys next time for the next live. Until then, take care and post your valuable feedback and comments. So take care. Good night. Bye.